Hi, everybody. Welcome back to the podcast.
Hi, everyone. For those of us watching the video today, me and Anne are both wearing our therapy sweaters.
Yes, we are.
These are required if you're going to be a therapist. These like long cardigans.
You learn about it in school. You know, you get all ready.
You're not allowed to practice unless you have these sweaters.
It's true, actually. Like most therapists I see have some kind of like cardigan, cozy sweater going on, that kind of look.
Yeah, and whenever I'm out in public, it's funny, like if I'm at a coffee shop or something, if I see like a woman walk in with like a longer sweater, I just instantly know like
you can spot them.
You're a therapist.
Yeah.
You know, it's just so for anyone who's wanting to identify who therapists are in the world, just look for the sweaters.
Yeah, look for the sweaters. It's true. My clients are like, if you are my client listening to this, you're probably nodding because I think most of my clients see me in some sort of sweater.
Yeah. Anyways, that's a side note.
Okay, our topic is not about sweaters. Actually, today we actually want to talk about the fact that chronic pain is hard, but feeling unheard about pain and symptoms makes it harder.
Yes. This is so common.
Yes.
And one of the reasons people are reaching out to us for therapy, not the only, like people want to heal their pain and symptoms, but people want to feel heard. Like as human beings, like we require that. Like we require that emotionally for us to feel heard and understood by someone and validated by someone.
Well, yeah. And I think when I meet with somebody right off the bat, like say the consultation or the first session, that's the biggest thing I feel off of someone is that they want to be understood. They want to be heard. They want to get their story out.
Yeah.
Because often clients are telling me they're not getting that as much as they need. They're not getting that from their loved ones. They're not getting that from medical professionals. This is something that they've been struggling with.
Yes. Yeah, it's unfortunately very common.
Yeah.
Anyone who's had chronic pain and symptoms has felt unheard or invalidated by people. And, you know, today we're going to really talk about this and how you can hopefully start to shift this. But I know Anne created a bit of a list.
Yeah, and I'll read that list. So this is statements that I hear from clients commonly about what messaging they're getting from people in their lives. So I'll read that out now. As you're listening to this, maybe take a moment to reflect on if you relate to any of these, if these are similar to things that you've experienced as well. So often I hear clients say they're being told it's all in your head.
Mm-hmm.
Just push through it regarding their pain and symptoms. Don't worry, it will just go away. You look fine. Lots of people have chronic pain. You're exaggerating your pain levels. Your pain treatments are costing us too much. Think loved ones or family. Can you just get better already? I don't want to talk about your symptoms anymore.
Really common statements.
Yeah.
And even as you read them, I was like, oh, that feels saddening that people are being told these things consistently from whether it's friends or family or like medical professionals in their life.
Well, and it's really heavy. Like, how did you feel even hearing that back, Tanner, in terms of your own experience?
Yeah, it just made me think back of all the times that I felt that way from people saying that. And it's interesting as you read the list, I think each statement, it could kind of be stated differently depending on a person's tone of voice or how angry they are. All are still affecting a person with chronic pain or symptoms. But sometimes like with friends, family, medical professionals, they would almost say these things like quickly and it wasn't, they weren't trying, I really don't believe they were trying to be really mean.
Right.
But it was very invalidating. And all of those things, like they're going to make you feel alone.
Yes.
They're going to make you feel abnormal. They're going to make you feel like you're to blame for your pain and symptoms. And that, as we know when it comes to neuroplastic pain, is going to increase danger and increase your pain and symptoms. Because, you know, our podcast is really dedicated to talking about neuroplastic pain and symptoms. So if you're new here, what that means is there's no damage or disease in your body. This is causing the sensations. They're occurring because your brain and nervous system has become sensitized from being stuck in this heightened state of danger. And so as you read that list, all of those things are going to make a person feel way more unsafe socially, in their relationships, in their larger world.
Yeah. And we really wanted to use our podcast today to validate that for the person experiencing chronic pain and symptoms, because it's so important to feel heard, maybe in a world and system where we don't. I wanted to share a little bit of a story from me and Tanner's experience of this. And so this is a memory I have that comes up often, actually, throughout the years. It just comes into my mind. I think it was just really impactful for me as your spouse, Tanner. Tanner doesn't know this, so this might be what I'm going to share. So this might be a bit of a surprise to you, Tanner.
New story.
Well, I don't know if it's a new one, but I don't know if you know how much this story made impact on me. So this was a time that Tanner was in chronic pain. It was before we were married. So a long time ago, we've been married actually for 10 years now. So before we were married, and I think we've talked about before how we used to go to Invermere, which is a few hours away from us, to like a rental property that Tanner's family had to spend time. And we'd often go on vacation. At this point in our relationship, we were struggling. We were struggling with each other. We were struggling to have good times. You were pretty deep into chronic pain, also struggling with your mental health. And that was quite apparent. It had been really impacting our relationship. And I remember we planned this getaway, and I had all these thoughts about it. I had all these hopes. I remember thinking, okay, this was going to be different. It was going to reset our relationship. It was going to be better than what we had been experiencing it. And I hadn't shared that with you. I kind of had that in my mind. And I was frustrated with you. I was frustrated with your pain. I was frustrated with your limitations and that we weren't able to do as much as we wanted to do. I felt, as your partner, confused and lost with how to support you. But I also felt this frustration that I kind of wasn't in the relationship I wanted to be, if that makes sense. Like we weren't engaging the way I wanted us to be engaging, or we were once, but we had lost that of it. And so there was all this pressure I had on this weekend, all in my mind. And I actually remember we were like driving up and I was thinking about that. And I was like, okay, this is going to be better. And like, this was this mental checklist I had in my own mind. And we got there and I think we had arrived. We were kind of sitting on the couch. And I remember my hopes were dashed. And I don't know if they were dashed because like you were in pain talking about it, or maybe like it was apparent that we weren't going to do what I thought we were going to do, or we weren't connecting the way I thought the trip would magically make us connect. And I think I said something at that point, like I told you, oh, we're not connecting, or this is what I wanted to do. So I started like raising that, but I was clearly frustrated. And you just lost it. And you lost it not in this like terrible way on me, but you kind of snapped and you got really angry, you got really enraged, very distressed. Suddenly, it's like you were quiet and then you're incredibly distressed. And I remember you stood up and you started yelling, and not necessarily to harm me, like not like that, but you started yelling of like, don't you realize how hard this is for me? And you're like, don't you know how much pain I am in, or pain I'm in? And it was like really shocking to me in some way. And I remember being really taken aback and being like, oh my God, what's happening here? But I also, it was like I was almost dumbfounded as your spouse, being like, whoa, I guess I don't realize. And it really made me it like almost hit me over the head of like, oh my gosh, like look at what's happening. And like you went into the other room and I went there with you and you were like in incredible distress. Maybe distress because like I didn't understand you,
Yeah.
or distress that you maybe had hopes for this trip too, but your pain was in the way. Like,
Yep.
But I remember it was like this turning point for me of being like, oh my gosh, I actually don't know or understand Tanner's experience.
Yeah.
And I get emotional thinking about it because it was really heavy.
Mm-hmm.
And it wasn't that my thoughts were wrong or your thoughts were wrong. It's just that I think I realized I didn't know what you were going through and I wasn't validating it. And you were in very difficult pain. Do you remember that? Like we might have had a couple of times like that through the years. So I don't know if you remember that exact
I do
one.
remember that trip.
Oh, you do?
I don't have a recollection of that specific freak out that I had.
Right.
I don't remember
Yeah.
that, but I do remember that trip. For the listeners, the context was I had actually gone off work a month before.
Okay.
So I was like...
It's funny because I don't actually remember all those details. Like I remember the actual trip.
Yeah, I went off work about a month before. Like I quit my job because the pain was too high.
Yes. Which is interesting because like I don't remember those details now, but I probably knew them then. But I still had trouble grasping what you were going through, even though there was all these signs of how difficult it was.
I do remember that. It is emotional because I remember that trip was terrible.
Yes.
Not specifically because of you. I just remember I remember probably being more depressed than I've ever felt in my life.
Yeah.
At that point. Like it was like I remember later in that trip, it was probably in the last couple of days. I remember going and like lying in bed. I don't remember like we did something during the day and I was in like a lot of pain and I went and lied in bed. And I do have a memory of being like, I have never felt this bad physically and emotionally. Like this is like the low. And to be honest, I don't know if anything, there's very few moments in my life that would probably be worse than that moment. And so it's hard when we're in relationships because in any relationship, we all make assumptions.
Yeah.
Right? Like I assume to know what you're thinking about or feeling, and you assume, you know, what I'm thinking about or feeling. But I think just in general, part of the loneliness that can happen from the human experience is like, no matter how much time you spend with someone or how much you share, like there always will be some level of disconnect of like understanding that person's inner world.
Yeah.
Like you just can't. And I think it's interesting because it's funny because me and Anne have gone to couples counseling like way in the past. And I remember one of the counselors being like, I've never found a couple that communicate as much as you and Anne. So like, I'm saying that for the listeners to understand that like, me and Anne are probably in like an outlier position of how much we communicated.
Right.
Probably a little bit less when I was so depressed.
Yes.
But still way more than most couples, I would probably say.
Yeah.
And so even for us, like, and I did feel that way. I felt like, not just from you, but from my friends, from my parents, from my doctors that I was seeing, there was this feeling of like, they don't get it. You know, like there was that like, that deeper feeling of like, I don't know what to say to have them get it.
Yes.
And I think that's where I would have these angry outbursts. Because I remember just feeling, and they were often not even directed at you or anyone else. It was more of like, I'm just so incredibly frustrated that like no one can understand it.
Yeah. And I think in that moment I described, I realized that there was so much going on that I just didn't understand. But still I had that part of me that was still frustrated. And that piece as the spouse or of the person in your life, that part was still there. And so I think I had to learn how to reconcile both, how to try to understand, but also honor my own emotions or my own experience, which is a whole nother podcast in itself, really, when we think about like loved ones or support people. But I also learned in that moment that I needed to try to understand. Like that was important.
Yeah, it was like a moment.
It was a moment. And also that there's so like, it made me remember, oh, things are hard for you.
Yeah.
And I think I could keep going along my life while you're in pain because maybe I didn't quite understand or know and like forget the difficulty that you're experiencing.
Yeah. And I would say that's very true. And what I want to touch on in what you said is that your feelings are valid too.
Yes.
Because I think sometimes this may be an unpopular opinion that I'm about to say, but you know, when you're the one suffering with chronic pain or symptoms, we do feel like we should be getting more support. And that's a valid feeling, right? Of course. Like, yeah, like, you know, people with pain and symptoms deserve to feel supported, deserve to feel loved, deserve to be cared for, to not be told those things that you listed off at the beginning.
Of course, yeah.
But it's hard. It's a hard pill to swallow that, like, the people supporting you are still going to feel things about this.
Right.
Because it's like the pain, and it wasn't because of me. It's not to blame. And I didn't see that at the time. Like, I had a lot of self-blame around my chronic pain in these types of moments. Like, I think part of the anger it was just the fact that, like, oh, I'm wrecking Anne's life, and I don't know what the heck to do about this.
Right.
Like, there was that.
Yeah.
And we can almost, you know, and this is harder, but it's important for people to understand, like, you're not to blame for your pain and symptoms. But we can almost externalize the pain and symptoms and understand they are affecting other people in our life. It's like they affected our relationship in a very negative way. They affected our finances. They affected, like, what we could do together, how we could connect. And for me to expect, oh, Anne should just go with it and support me no matter what, it's like, yeah, sure, you should support me, but it's like you're still valid, like your feelings are still valid.
Well, and I think it was confusing for me as a spouse or a loved one because I kept trying to just fix it away. Like I thought the weekend would be magical, it'd be this reset, which is really common for couples to think. You know, you go on vacation, you have a reset, and would fix it for both of us. But then in that, I realized I was really dismissing everything that you were going through and like almost making it really little. And then I couldn't help but have those thoughts that were like, ugh, like, let's move on from this. Like,
yeah. And this, you know, even as we're talking about right now, I'm thinking in my mind, like, ooh, this is messy. This is messy stuff because it is messy.
It's complicated and messy.
And, you know, for the listeners, I think it could be important for us to reflect on knowing what you and I know now, Anne. If we went back in time when I was in pain.
Like a time machine.
I don't really want to go back to when I was in pain, but if we went back in time, like, what would we do differently? And
oh, that's a good question.
I think, because that's it. It's like the person who's having chronic pain or symptoms, like, we want to feel heard, validated, loved,
and I
supported.
think about this list, I'm just pulling it up again. Like some of the things I had said is all in your head that people are hearing. Just push through it. Don't worry, it will go away. Like, I am horrified by this list that I gave you some of that messaging. Yes. And so if I go back in time, I would never want to give you that messaging, even though maybe my frustration was valid.
Yes. And you're right. Like, anyone who supported someone with chronic pain and symptoms have probably said things on that list.
Yeah.
It sucks to say. Most people don't want to admit that. But I think we can, while we're healing from neuroplastic pain and symptoms, we can start to change the way we function in relationships to support both parties.
Yes.
And it's like, I can't expect Anne to know what words are stinging me. And so, you know, I'd love to expect that. And some bigger things people should have insight, but probably don't. But I think if I went back in time, I would have much more open communication of like, hey, when you say this line, or when you say just ignore it, or when you say just push through it, or it's all going to be fine, we're going to have a good holiday. Like, when you say that stuff, it makes me feel like you don't understand what I'm dealing with. Like, that was never stated.
No, we didn't really have that.
And so for the person who has pain and symptoms, you can't expect the people around you to be mind readers.
Yes.
They're not going to be. You need to communicate clearly with them what it is you need them to stop saying and what it is you need them to start doing so that you feel heard and supported.
Well, and I think as the other person in the relationship, once we had that experience on our trip, I was much more willing to take your experience into account and trying to make sure you're heard. So even though that felt overwhelming and it was a bit explosive and there's a lot of high emotions, like it wasn't an easy time, obviously, for you. It was not a good trip as well. Yeah. We needed that to kind of, so I could get more understanding. So I'm not saying like blow up your spine, like that's not what I'm saying.
Yeah.
But that kind of deep, honest communication is important in this.
Mm-hmm. It is. There needs to be that honesty, and it will be emotional.
Yeah.
The conversation that I'm asking the listeners to have right now, that will be emotional.
Well, and I needed that. And so and in some ways I needed to see how emotionally distressed you were, Tanner. Yeah. And again, we're not, make sure you're safe in your relationships to be this open and honest, of course. But I think when you were going along, kind of not telling me about what was happening, I kind of forgot. And I was like, oh, he's fine now. It's fine. Let's move on. Like I didn't, it was hard for me to stay in your pain because I wasn't in it. And it doesn't mean you always have to be in it together. But I think there needs to be this communication of what both people are experiencing.
Yes. And the key there is what both people are experiencing.
Yeah.
It's an emotional conversation, but it's like, as I shut down more and more, I did not express to you what I was going through with my pain and my mental health.
No.
I just didn't. There was clear signs like externally, but like I wasn't clear in my communication. So how could I expect you to understand if I'm, not doing that, and vice versa? It's like you weren't expressing what you're going through in all of this.
No, and I think this is common for other partners. Like I had this idea of what were going to happen. I started to express it, but I had those long hopes and pressures about our trip long before. Yeah. Like it had gone up to a boiling point for me when it wasn't happening how I wanted it to happen. Mm-hmm. So communication more consistently would have helped us.
Yes.
Yeah.
It would have been incredibly helpful. And I think the other thing when I think back, and this is outside of our relationship, but people need to assess the relationships that they're in. And I mean with friends, partners, families, and medical providers.
Okay, why do you say that? What do you mean?
Because the advice we're giving right now and that we just gave is like, oh yeah, you need more open communication. Both parties need to be sharing what they're going through. Obviously sharing that in like a respectful, caring way. But you need to assess what relationships are actually safe for you to be doing this. Now, yes, sometimes it's like very toxic abuse, which is terrible. Like open communication is not going to be safe in those situations. But I also think it's farther down the spectrum from like toxic abuse to more, people just haven't really shown that they care that much about you. They're disinterested in how you're suffering. They always kind of say slight, mean comments to you. Like those people, no matter how much communication, you're probably not going to change. And so, yeah, I remember there was a few physios I went and saw. Terrible bedside manner. It was awful.
What was it like for you? Like, do you remember some of the things they said?
Yeah, like I remember feeling angry. Like I remember the one guy, he was this like kind of old school physiotherapist. I only went to see him because my main physio was like on vacation for 3 weeks. Right. Which was very stressful for me because I relied on her greatly before coming to this approach.
Yes.
And I remember when I walked in, and I was trying to express to him, like, yeah, I'm like widespread pain. It's been about 3 years. Not getting better. I'm struggling to like walk more than 10 minutes, like basically bedbound. That's where I'm at. And he was just kind of like, he was like, you're a young guy. You can just like go do it. You'll be fine. Like there were like comments like that.
Yeah.
And then he like,
I remember that. I actually remember you telling me stuff like that.
And like, And he did this like stretch routine where like my body was just overwhelmed. Like it was too much. And I told him how sensitive I was. Like he was just like very invalidating of like, you're a young guy, get over it. Right? Like that kind of like, it was kind of like hockey room talk. That's what it reminded me of.
When you left that session, Tanner, like how did you feel about your plan moving forward?
Oh, I remember at that point, I couldn't even get angry. I just felt like despair and like critical of myself.
Yeah.
So it's like people like that, there's no point in having more communication with them. It's not going to improve things. So there are lines here, like me and Anne are saying, like in safer relationships where someone is just misunderstanding what's going on and they're willing and they have some insight and they're willing to change. That's great. Do what me and Anne are talking about today. But if you have these people that are on that spectrum of abusive, that's probably not going to change unless that individual gets a whole lot of self-insight and therapy.
Well, and it's true. And sometimes we need to take a look at the people that we have in our lives, and can we feel heard with them, or how can we get that piece in there? Because when we think of, back to our title of this podcast, when we're not feeling heard, it makes pain and symptoms much worse. And so we want to feel heard within our journey. We need that safety.
Yes. We need that. We need to feel heard. We need to feel listened to. And specifically, the point that I want to end on today, because we've talked about this actually in our new big project, we had a whole section on this.
Yeah.
You need to get people on your mind-body team. So like,
and not just professionals, but others.
But like friends and family.
Yeah.
Like I felt greatly supported when I was healing because you took the time to listen, understand the science, read some of Dr. Sarno's books. Like that felt incredibly supportive and like connecting to me. Mm-hmm. And like that was very useful. And so there's so much free content now. And so ask the people that are supporting you, whoever they are, if they could watch just these 5 videos or listen to these 5 podcasts, because like that's going to create a feeling of supportiveness and connectedness. And then they know, oh, this is why they're doing what they're doing. This is why they're meditating 30 minutes a day. This is why they're journaling. This is why, it builds such great understanding.
Well, and I remember that. And we got to this place kind of when you were working on the healing journey. So past that incident that we described, I remember having that understanding of what you were doing and why. But then I was able to support you better. I felt like I was in it more with you. And those frustrations I had of like, oh, just get over it. This obsession I also had of trying to just fix it. Yeah. That kind of quieted down for me as a spouse. Mm-hmm. And that was really important because I could be a part of helping you with that journey. Yeah. And I remember that. Yeah, that was a huge turning place for us.
It was a big, like, I felt like we were in it together.
Yeah.
And that was like, compared to where we were at on that holiday, night and day. Yeah. And, I think, not to give me and Anne too much credit here, I think that kind of just happened naturally. Like we sort of just like basically get hopeful together and bought in together to this idea of neuroplastic pain and using a brain-based approach. But yeah, like I would strongly recommend, hey, if you have people around you that are safe and, supportive, you're just miscommunicating, I would strongly recommend get them involved in your healing in whatever way they're willing, right?
Yep.
I've had couples meditate together, start to do some like graded exposure to movement together, like start to like read the books together and discuss them. Like that's going to be very helpful in terms of feeling heard and feeling validated.
Yeah, for sure. And even at our clinic, Pain Psychotherapy Canada, we do also work with spouses individually on a therapy basis as well. And so that's something that we provide and also can be helpful because I know what it's like to be that partner. And as we said, it's not an easy journey either.
Yeah. Well, I hope this episode was helpful for everyone.
Yeah, we hope so.
Yeah. And we'll talk to you soon.
Talk to you next time.